Interprofessional Practice in Nursing. I have with me Miss Rachel Whitmire, Nursing Home Administrator. Thank you for being here. Do you give me permission to record you and record this interview?
Absolutely.
So this is for a class that we are speaking to professionals about in their field, and you are one that I chose to interview. One of the questions I wanted to ask was, what led you to choose this profession that you're in, and how long have you been in this role?
Um, what chose me, I mean, what I, what led me to choose this profession, was that, being a nurse in quality assurance and infection control, worked very closely with the DON and the administrator that we had during that time. Um, and so working on quality measures and, um, projects, performance improvement projects and things like that. I fell in love with analyzing data and looking at processes and really digging in to try to find the root of problems, and communicating with the frontline staff on, you know, why did that really happen? And so just that data analyst analytics, and getting to the root of what was wrong, and being able to develop, processes and procedures, and in doing those, it improved the quality of care for our elders, and it also improved the workflow and, all for our team as well. Uh, I've been the administrator now for 2 years.
Um, what types of population or patients do you work with typically?
Uh, it's geriatrics, and geriatrics with multiple comorbidities.
Okay. Um, can you tell me why you chose this profession to be a nursing home administrator?
Excuse me. Yeah, I wanted to continue to be able to help people, and with learning everything that I learned through quality assurance and infection control, um, because I'm a nurse at heart, by trade, but I wanted to continue to be able to help people, specifically to help older people in the vulnerable population, to live out the remainder of their lives with dignity and respect and love and those things that we all need as human beings.
Absolutely. What is your educational background and preparation for this role?
Um, I started in healthcare, in some form or fashion, right out of high school. I was a CNA, for a year, and then I went to EMT school, and, well, I had a little gap there. Had some kids, Um, then I actually, went to EMT school, got my EMT, and I was an EMT and a volunteer firefighter for about 8 years. And, then I actually, as an EMT, took a safety position, for it was for a, production line, or production company. And, then, there were big layoffs and everything, but, I decided to go back to nursing school. And so I was a LPN for 15 years. Um, and then now an administrator for 2. So, I think a little bit of that, just being in healthcare overall, and then being a CNA, the EMT experience that I have, um, working in an industry that is not healthcare, as, still a healthcare provider, and then, my LPN experience and quality assurance experience, infection control experience. I think all of those things kind of helped me prepare to be a nursing home administrator.
So definitely had a background with giving back to the community and
Yes.
giving to others.
Yes.
Um, what would you say your primary role is and your responsibility when you're collaborating with your nurses and other healthcare professionals?
Um, my responsibility is to guide the interdisciplinary team, oversee daily um, operations, um, um, really to just think outside the box to achieve positive outcomes for our elders, and to look at where can we, what do the elders need, and what can I do to help better support the frontline team and the interdisciplinary team um, to give good outcomes.
And what would you say? How does your work as an administrator directly impact those in patient care and their outcomes here?
Um, I'm able to use my experience as a nurse to guide decision making in care related areas. I work in improving quality measures and um, just tracking and trending and making decisions just based on what our interdisciplinary team um, sees and with collaboration with them for improving patient outcome.
And what are some key challenges when working with your interdisciplinary team, and how do you overcome those challenges?
Um, some challenges of working with the interdisciplinary team is um, different people, different ideas. No one, there's no one idea that's right or wrong. It takes a whole, like a collaboration from each perspective of each discipline to really make true improvements. Retention is a challenge as far as staffing in a whole, and some challenges of really getting to know the people that you work with and um, valuing their input. That's not a challenge, but you have to value each person's input and their voice.
Absolutely, absolutely. Um, well, speaking on interdisciplinary team, in your experience, what would you say makes a strong and effective interdisciplinary team?
Um, in my experience, what makes a strong interdisciplinary team is going to be clear roles and responsibilities, very strong communication between team members, no matter at what level or what role that your team member has. Respect, trust, shared goals, active participation from all of your IDT team, resident and family centered focus, consistency, uh, continuity, and just listening and working through things as a team. No one person has all the answers.
That's that's really good. That's good advice. I love that. Um, so how more on your role, how do you prioritize and balance your role with the role of your interdisciplinary team members to make sure that communication and not necessarily communication, but comprehensive patient care is given?
Uh, in my role, I prioritize by first ensuring that policies and staffing and resources are aligned to support high quality patient care. Um, I take responsibility for overseeing compliance, managing budgets, ensuring efficient daily operations by staying organized and proactive on things. and by doing that, I can quickly identify areas that need attention and delegate those tasks, or, um, you know, implement things that we need to really be looking at or monitoring very closely. I can do that pretty quickly. Um, I respect and support the roles of my team members, and trust that they can do their jobs. And I stay focused on my responsibilities to create an environment where they can provide optimal care in a trusting environment.
Good. Um, can you share a case where interdisciplinary collaboration improved patients' health or quality of life?
Um, we have something that are called well-being interviews. And so each interdisciplinary team member has a certain set of rooms that we do these well-being interviews periodically. And then that interdisciplinary team is responsible for coming back and then sharing that with the entire interdisciplinary team. Um, Through that process, we learned, um, we really learned on one particular elder, that she had tragically lost her brother. Um, and so he was overseas, and he was basically like her right hand. He was her best friend. And so we learned that she's not necessarily secluding herself, but a lot of the times in our common area, some of the shows that they would put on at certain times of the day, it automatically goes to like war movies and things. And so we realized that we could give her we could set a schedule of that those movies will be able to be viewed in the common area at particular times of the day, and she could utilize those times of the day to do other things, and it actually improved her mood. She was not in her room as much. She just kind of come out of her shell after that, but that was a very big trauma for her. It caused her grief and to remember the loss of him. And so that greatly improved her quality of life of not having to remember that, every day.
Um, that's deep. I love that. That is something that we don't think about
That's
a
right.
lot. Not just we think of what we can include in their lives, but sometimes you have to take some stuff away.
Right.
Um, so how do you think that nurses could collaborate with other disciplines or with your discipline specifically more effectively?
Um, Collaboration between nurses and administrators is critical for the success of any home, any community. Um, it's critical to the well-being of our residents. Nurses can collaborate more effectively with administration by maintaining open, honest communication regarding resident care needs, staffing concerns, operational challenges. What are things that are barriers to them being able to really perform high quality care, and take care of our elders, our residents, the way that they need to be taken care of. Uh, when nurses share their feedback timely, it allows me to advocate for necessary resources, whether it's adjusting staffing models, to meet the needs of elders as things change. Implement policy changes that support both the staff and the residents. I encourage my nurses to actively participate in quality assurance meetings, care conferences, and interdisciplinary discussions. So their clinical insight directly inform me and other administrative staff, um, and we're better able to make decisions. Um, so that partnership, it just creates a more unified team approach to make sure that we're making the best decisions for our elders and staff as a whole.
Speaking of staff as a whole and your interdisciplinary team, what technology do you use or utilize in your setting that provides better collaboration with your nursing and your staff? Is there any technology or processes or tools that y'all have that helps with that process of communication?
Um, we use technology that we use is secure conversations function. That is with our charting system, which is point click care. Um, that is gives our nurses gives them the ability to send updates and notifications to therapy. To nurses can send communication to each other. They can send communication to me. They can do general communication that's not tailored to anything, or they can send resident specific communication. So if a nurse is seeing that something is changing with an elder, they're not, they seem a little bit weaker than they were. If they notice that they're, uh, you know, this is the third night in a row that I've checked their blood sugar and it's been a little elevated 3 nights in a row, they can send communication straight to the physician. And so that communication just is a solid flowing to where everybody can get things communicated to them in a timely manner, because it's very easy. As being a floor nurse, there may be something that you have on your mind that you think, oh, I need to let the RN supervisor know about that, or oh, I need to tell Rachel, I need to tell the administrator that the tub's not working and maintenance has looked at it, and I don't know if they've communicated that to her. So it's just, but being a nurse, you get sidetracked because you have other patients to take care of, and so a leaking whirlpool may not be on the top of your priority list when it comes to taking care of 30 other people. But just those slight changes in elders. Being able to communicate those so therapy can say, hey, we might need to evaluate them and see if we need to get them started on the program. That is one tool that we use.
And like, would I be able to go in and see what that person had requested to that doctor or notify them?
And so,
it wouldn't get lost in an email or
it wouldn't get lost in email trains or threads, or because we all get a million emails a day. And it also, if you say, well, this was going on, or we noticed this today, you could go back and actually look and say, oh, yes, the nurse last night did communicate that to the physician. I just need to follow up on that, because just like nurses' notes, just like I was saying about, a whirlpool leaking, sometimes if you get really, really busy or something major happens, you have to send someone out, or you have a fall or anything like that, that nurse's note may leave your mind when you're actually doing your charting. So it's just a way, to better communicate things as they're happening. So if I did forget to make a nurse's note, or I forgot to put it on the RN's desk, it's still communicated so that we can be proactive on catching those things.
That continuum of care is always met. Um, almost done, but can you describe how your education has prepared you for interprofessional collaborative practice? Like how has your background helped you in this?
Um, I think that my training and my experience in working in several different levels has really it's taught me and helped me to realize that the value of the interdisciplinary team's voices related to problem solving, effective communication, a better way to do things. For our elders and their care. Every team member has, I mean, every role, every team member, they play a vital role, regardless of their position. They bring knowledge, they bring insight, they bring um, valuable information uh, to the team, and you know, listening to everybody's voice before just making a decision, um, it benefits our goal of providing high quality care.
That's fantastic. And last question, and I'll be out of your hair. Thank you for this, by the way.
You're
But
welcome.
is there any advice that you would share with me that you would have given to your younger self starting out in healthcare as a professional?
Um, don't ever assume that you know more than anybody else just because you have a degree or you have a certain level of education or you have a certain title. Um, every role is equally important, from the groundskeeper to the housekeeper to the nurse to the COO of your organization. Um, everybody has, like I said, a different perspective, um, and everyone has wealth and they have value that they can bring to your team. Take every opportunity that you get to learn from anybody who's willing to teach you for a moment, because I have learned from so many people. Just everybody's perception is different. Everybody's people pick up on different things. People who have been doing this for a long time, I can guarantee you know a better, more efficient way to do something, and it have a positive outcome, better than just somebody fresh off the street with book sense. Everybody adds value. Every team member's voice is important.
Fantastic. Well, I appreciate your insight and your time that you have spent with us. And I hope you have a wonderful day.
You too. Thank you so much.